So in this section, we'll be talking about medications or pharmacotherapy for migraines, different classes of medications that we can use to treat headaches in children. I've broken the pharmacotherapy or medications down into 4 sections: symptomatic treatment, abortive medications, preventative treatments, and rescue medications. These are outlined a little better in your study guide also. The first class of medications, symptomatic treatments, just medications that help the headache pain itself. These are basic over-the-counter analgesic medications: ibuprofen, naproxen, acetaminophen. These tend to lessen the headache pain, and if it's used very early on in the headache, may have some sort of abortive quality to it. That means it may prevent a migraine from developing in children if it's used very early on. Now, the problems with using over-the-counter analgesics have to do with those rebound headaches that I talked about earlier. For any sort of over-the-counter analgesics, that's ibuprofen, naproxen, acetaminophen, those nonsteroidal anti-inflammatory medications, you never want to take them more than 3 days a week. Otherwise, you can develop rebound headaches. It's where you take a typical sort of migraine and it turns into something like a transformed migraine, and then we have lots of troubles trying to get off of the over-the-counter analgesic medications. These over-the-counter medications don't treat the washed-out period afterwards, that postdrome, which many migraineurs and headache sufferers report as being the worst part of the whole headache episode itself. The next class of medications are abortive medications. These medications, when they were introduced in the 90s, were described as a miracle treatment for many migraine sufferers. These abortive medications work on the underlying pathophysiology, what's really causing the migraines, the contractility of the blood vessels. These medications work best when they're taken very early on in the migraine to prevent that whole cascade of events that lead to the dilation, expansion of the blood vessels. And so when they're taken very early on in the migraine is when they work best. These medications work very well for people who have classic migraines. When you have those sort of vision changes before the migraine comes on, that's when the abortive medication should be taken. And they're very effective. 70 to 80% of people will have no progression of their migraine when taking an abortive medication. The side effect profile of these medications is pretty mild. You can have a little bit of a racing heart, shortness of breath. Some people describe a fullness in the face, but mostly it just makes people a little bit sleepy. The sleepiness that comes along with taking an abortive medication isn't necessarily a bad thing. For many migraineurs, taking a nap is a welcome relief, and then when you awaken after taking a triptan medication, the migraine's gone. But not everyone gets sleepy from triptan medications. It's just the most common side effect. The one potentially serious side effect from triptan medication is something called Serotonin Syndrome. It's where you have an increased level of serotonin. It's important to let your doctor know anytime you're taking these medications. They might not want to prescribe other medications that increase your serotonin levels, but overall a very well tolerated class of medications. The next class of medication are prophylactic or preventative medications. This is a diverse group of medications which were all discovered serendipitously or by accident to help for migraines. This can include anti-seizure medications, some old-style antidepressant medications, blood pressure medications, even antihistamines. The FDA-approved medication for migraine prevention is Topiramate. This medication, again, is a very well-tolerated medication with few side effects. It's used in very low dosages for migraine prevention compared to what you might use if you were treating someone for epilepsy, its other FDA indication. The main side effect from it can be some stomach upset, maybe some sleepiness initially, but overall a very mild side effect profile. Some more serious potential side effects include things like increased pressure in the eye or kidney stones. These are very rare and unusual side effects, especially in children. And one note about this medication is it's off-label for use in children. It's FDA approved for adults, something that should probably be prescribed by a specialist. But a nice preventative medication for when people have 2 or more prolonged and debilitating headaches that are very severe, lasting longer than 48 hours, causing significant impact on their lives, missing work, or school, or extracurricular activities. The other non-FDA approved migraine preventative medications, propranolol, older style blood pressure medication, and tricyclic antidepressants, medications like Elavil, and nortriptyline. The last class of medications are rescue medications. These are medications that I'll tell families should be taken very infrequently. Where I'll sometimes prescribe these is when families say, this is one of my child's very typical migraines, but it's a really bad one. It's so bad that we might have to take him to the emergency department. Nothing really otherwise unusual or unique about this headache except the fact that it's very severe. This class of medications is stronger analgesic medications, sometimes opioid analgesics. I very rarely prescribe these medications, and I'll often tell families this is a last resort. This is where you're trying to avoid something like a trip to the emergency department. I'll often prescribe 10 and expect them to last until they expire or last for a year. Thank you for your interest in watching the video. I hope it's given you the information you need to help improve your child's quality of life. Please check back to the website regularly, as we'll be frequently updating it with new information.